Okay, everyone, let's take a look at the functions of calcium. So we're going to talk about the thyroid, the thyroid connection and the parathyroid connection. So both thyroid and parathyroid are involved in regulating calcium balance. Remember, the thyroid uses calcitonin to do it. Calcitonin. And the parathyroid is going to use parathyroid. It's going to use parathyroid hormone, PTH. Now, when we think of calcium, we think of bone density. So when you don't have enough, you can get bone weakness or osteoporosis. We think of strong bones, strong teeth. When I think of calcium, I think of the ability of clotting. Calcium is involved in the clotting cascade. It's involved in nerve signaling. It's involved in muscle contraction, and it's a cofactor in releasing other hormones and other chemicals, and it's involved in your normal heartbeat. So calcium being in that tight range of about 9 to 11 on your blood results, it's either 9, 10, 11, having too much or too little can really create these imbalances. One of the ways to determine if there is any type of calcium imbalance, like hypocalcemia, too little calcium, can cause overexcitability of the nervous system, and it can be shown with muscle spasms found in the hand and the feet. And when the thumb goes into that spasm, they call it carpopedal spasm. Okay. Now, when we look at calcium homeostasis, the body can use the bones, the body can use the kidneys, or the body can use the intestines to either store, to pull, or to push, right? If you look at the arrows going here, well, we have calcium that can be stored in bone or can be pulled out of bone. Okay. So you can have calcium from your blood going into the bone to be stored, or you can have calcium from bone that's being broken down and pulled out into the blood. It could be both ways. Okay. You can have calcium that's pulled from your intestines from food you absorbed, and it can pull it into the blood, or you can pull and reserve calcium from the kidneys, and instead of peeing it out, you can store it. So your body can use the kidneys to excrete, the kidneys to shut down and put things back in reserve. Your bones can be broken down, or we can reserve calcium in the bone. So calcitonin is secreted by the C cells of the thyroid gland when the blood calcium concentration is too high. When there's too much calcium in your blood, it's called hypercalcemia. Hypercalcemia. So PTH, parathyroid hormone, is secreted by the parathyroid gland, and it's released when the calcium level is too low. Hypocalcemia. So when we have this, we can have, again, the bones, the digestive tract, or the kidneys involved. So what we're looking at is that we have low calcium ion. When the calcium is too low, your parathyroid gland is going to push out parathyroid hormone. Now, the goal is that, hey, we had too little calcium. What can we do at the end result to increase calcium levels? Well, bone, maybe we can break down bone. We can use osteoclasts, which can break down bone, and the calcium that's broken down from the bone, that can increase blood calcium level. Well, the intestines can respond, and it can say, hey, we need to increase calcium, so let's absorb some quickly. And it can absorb some because the kidneys are involved in producing vitamin D. Vitamin D goes to the intestines and says, let's absorb some calcium from our diet and we can increase our calcium levels. And at the same point in time, the kidneys will say, hey, we're not going to pee out any additional calcium in urine. We're going to conserve it all. So bone, intestine, and kidneys are involved. And the same three parts are involved if the calcium levels are too high. The thyroid gland is going to release calcitonin, affect again the bone, the intestines, and the kidneys, but now it's going to try and decrease the calcium level. Well, if there's too much calcium in the blood, we can put additional calcium in the bone. If there's too much calcium in the blood, we will decrease the rate of intestinal absorption by the kidneys shutting down, saying, hey, we don't need more vitamin D. We don't need D, so we don't need to absorb all that additional calcium. And at the same point in time, if there's too much calcium, the kidneys can find a way to increase calcium loss through urine or through urination. All ways of decreasing calcium. So in this particular case, we see some sort of stimulus rising the calcium level. So the thyroid says, okay, we have too much calcium. We're going to release calcitonin, and calcitonin is going to store calcium in the bone, right? We're going to store the 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 depositing of any additional calcium here, and we're going to reduce any type of calcium uptake in the kidneys. Okay, and that will help to stimulate the fall of the blood calcium because it was too high. Now, if it drops too low, then the parathyroid gland pushes out parathyroid hormone, and that's going to affect the bones, the kidneys, and the intestines. And it's going to say, all right, parathyroid hormone, let's increase the calcium uptake in the intestines. And that's because the kidneys produced vitamin D. That's going to have the ability to increase the calcium absorption at the intestine. And we're going to we're going to stimulate the calcium release from the bone. We're going to break down using osteoclasts. The osteoclast will break down the calcium in the bone to increase the amount of calcium, raising the calcium levels. Okay, so there's that relationship between the thyroid and the parathyroid. So we have the thyroid gland, we have the parathyroid hormone produced by the parathyroid gland. The thyroid gland is going to push out calcitonin. What is calcitonin going to do? What is parathyroid hormone going to do? Calcitonin's goal is to decrease calcium level in the blood. Parathyroid goal is to increase calcium levels in the blood. That's the take-home message there. Okay, when we come back, we'll talk about the adrenals. Everyone doing okay? Just to make sure you're following along on that. Any questions so far? Everyone's good? Okay. We're going to move on to the adrenals.